Welcome back, guys. Today we're gonna talk about the irritable bowel syndrome, or IBS. So what is IBS? IBS, it is just an abdominal pain without any structural abnormality. But this abdominal pain should be associated with two of these three things. Should be related to the defecation, should be there is a change in stool frequency or stool consistency. So the patient will be, for example, the patient will say, I have an abdominal pain, it's increased with defecation, and I was defecate 2 times a day. Nowadays I just defecate 1 time per day. Or I was the consistency or the caliber of my stool, it was a normal, nowadays it become a loose stool or more hard stool. That's the consistency of the stool. It is most commonly associated with the middle-aged women, and chronic symptom may be persistent diarrhea or persistent constipation or mixed between diarrhea and constipation. The pathophysiology of it, it's multifaceted. Most of it is still unknown. The first line of treatment is a lifestyle modification and dietary change. That is the irritable bowel syndrome, as simple as I can. Now let's talk about the appendicitis. Appendicitis, it is the most common disease or most common to see in the young age person. Appendicitis is an inflammation of the appendix. So here we see the appendix in CT scan, and we see the white point here. It's an obstruction. This obstruction in children, it's usually lymphoid hyperplasia, or in adult it is fecal obstruction. Proximal obstruction of appendicial lumen, closed loop obstruction, increased intralumen pressure, and stimulate of visceral afferent nerve fiber at T8 and from T8 to T10. So T8 and T10, it is innervated the para-umbilical or the somatic feeling at the site of at the level of umbilicus. So the earliest signs of the patient with the appendicitis is the para-umbilical pain with an vague para-umbilical pain. The patient cannot describe this is a sharp pain, heavy pain, or colicky pain. He will not describe that pain. He just feels a noisy pain, just area in the para-umbilical area. After that, the inflammation will be extend to the cirrhosis and retain the parietal peritoneum. Here the parietal peritoneum is innervated by somatic nerves. So the patient will feel sharp pain in the right lower quadrant or the right iliac fossa. So this area with pain, we call it McBurney point. McBurney point, let's imagine this is the pelvis and this is the umbilicus here. It is at 1/3 distance between the superior anterior superior iliac spine and the para-umbilical area here. It's just in the tail. The main symptom with the appendicitis is nausea and fever. So it may be perforated to cause the peritonitis, maybe illicit psoas because we have a psoas sign. When the patient raises the right leg, he will feel the pain because contraction of psoas muscle. Obturator, also obturator muscle, because have a strong relation with it. Reversion sign, garden, and rebound tenderness on the examination. Rebounding tenderness, it is the pain when the doctor tries to push the area of the right iliac fossa, and when he releases his hand suddenly, the patient will feel sharp pain. Differential diagnosis for it is the diverticulitis. We will talk about the diverticulitis next video. And ectopic pregnancy, because I have a near site, we use the HCG to rule out the pregnancy in the patient with the right iliac fossa. And pseudoappendicitis, the treatment of the appendicitis is surgery, it's just appendectomy.